r/AskReddit. Doctors of Reddit. What's the most incorrect patient self-diagnosis you've seen? I had a teenager and her mom come in worried she had some kind of serious circulation problem because her toes were blue. I looked at her feet and thought that's not really the right shade for loss of blood flow. I grabbed an alcohol swab and proceeded to wipe the blue color off the tops of her toes. I think it was from her new jeans. During a particularly cold morning after crew practice, one of the novice coxswains, person who steers the boat, had gotten wet from backsplash and was shivering. When a few senior rowers noticed that the poor guy's fingers had turned blue, they immediately started doing everything they could to warm him up, including sticking his shaking hands into warm water, where the blue dye from his gloves immediately washed off. That's really sweet that they tried so hard to help him, though. As a paramedic, I responded to a dispatch for a sick person. When we arrived, this old guy was clearly having a stroke. He said I just ate some bad fish or something before taking a 3-hour nap. Luckily his wife finally decided to call 911. That wolf made a funny tombstone though. I just had some bad fish or something. Oh, darling. You didn't use canned salmon, did you? Pediatrician here. A lot of parents come in thinking their child has cancer because they won't eat anything. Actually, they just don't like vegetables and are eating themselves to obesity with the crap you substitute it with. Or the parents never learned how to properly cook vegetables and make them not taste like plain ass. I didn't like most vegetables until my sophomore year of high school because that was when I learned how to cook them myself and actually use, gasp, spices in it. Or the parents who insist on cooking vegetables in the first place when I'm perfectly happy and willing to eat them raw. Not a doctor, but a psych first responder. Patient self-diagnosed as dead. EMTs didn't believe him. He was quite insistent though, and wanted an ambulance ride because he thought a dead person ought to have one. The EMTs argued with him, stating that he was both standing and talking. He countered that he was in hell. In fact, he was just pretty high with a bad drug combination. I had a fun hour with him while he came down. I have schizophrenia and I have thought I was dead before. It's very hard to stay at work when I think I'm dead. Because why would I work if I was dead? Well, I don't know if it would help you. But with him, I just refused him on rebirth without telling him he was dead because I don't tell people false information, even if they believe it. I asked him to consider how he might like to be reborn in the next life and let him focus on that. It was a very interesting philosophical discussion. He ended up thinking I was Lucifer. But he was okay with that and appreciated the advice on climbing out of hell. Might work for you too. Next time you're dead, consider thinking about what you'd like to change into in the future. As a medic, I had a soldier run up to me and demand to see the PA. When I asked why, he said his girlfriend has BV and now he's sure he does too. I assured him that he most certainly did not have bacterial vaginosis. Edit to add a note, the soldier in question was symptom free. And we definitely still let the soldier see his provider. How do you know that? His general lack of a vag. Not a doctor. But my roommate was convinced that she had Hodgkin's lymphoma because she used to wake up with a pain in her left arm every time she'd drink on a night out. She googled it and found a blog post from a woman who had lymphoma which was exacerbated by alcohol, so she'd get pains in her lymph nodes after drinking, so obviously this is what she had too. She had breakdowns every time she'd drink. Full on sobbing because she was absolutely convinced she had cancer every time she'd have a twinge in her arm. Turned out that whenever she was absolutely smashed, she'd literally fall into bed and sleep awkwardly on her arm for 8 hours. Doctor, it hurts when I do this. Then don't do that. That'll be $300. Thanks, America. Elderly man with dementia brought in for suspicion of toxic epidermal necrolysis, a serious and life-threatening reaction where your skin peels off and sheets. Nope. It was a very large burn because they left grandpa alone at the house and he spilled a teapot on himself, and the family and another hospital were too dumb to figure it out. 10 as old as time. If I had $1 for every patient who thought dermatitis from laundry soap was SJS, I wouldn't even have to work anymore. This one blew our minds because it was a fresh scald with some intact blistering sent from another hospital. So the ED physician completely misdiagnosed a very obvious burn for a pretty rare rash. I would say after a couple years working in an emergency room before and during medical school, that by far the most common egregious self-misdiagnosis involved pregnancy. Tons of XLE active patients coming in complaining of morning sickness and gaining weight. And just sure they have some sort of GI issue or infectious disease. When it comes around to asking questions. Oh yeah. Come to think about it, I haven't had my period in 3, 4, 5 months. That's not to mention the people coming in fully in labor and delivering in the ED. Truly shocked that they were pregnant at all. Now I understand people can have irregular periods and there are many cases where the patient is reasonable in not guessing what's going on. But there is a large group of patients who missed a lot of obvious hints. Denial ain't just a river in Egypt, I guess. And I do have empathy for patients in situations where they really don't want to be pregnant and so perhaps are subconsciously blocking it out of their mind. But a medical mystery it is not. When I was in high school I started getting really nauseous in the mornings. It seemed the more I tried to do in the mornings the worse it would be. And it was really troubling for me. Had my mom take me to the doctor and the first thing the nurse asks upon hearing my symptoms was if I was XLE active. I actually wasn't at the time and told her no. She thinks I'm lying. And maybe I'm too scared to admit it in front of my mother. She takes me aside and asks me again in private. And I tell her the same thing. She responds with, you know there is no point lying about this, right? We are going to find out. This honestly made me pretty angry. Something was not right with me and I really wanted them to find out what was causing it, but if no one would take me seriously, that wasn't going to happen. So she orders a pregnancy test. Test comes back negative. She orders 3 more pregnancy tests. Yes. 4 tests in total. Those come up negative as well. She actually seems angered by this, which I found to be profoundly unprofessional. This is all done by the nurse before the actual doctor had come to see me, and when the doctor finally shows up, I hear her say to the doctor in the hall, she might be too early along still and that's why it's giving false negatives. Well, I was surely not pregnant and was actually experiencing physical symptoms of anxiety, and I overheard the doctor scold the nurse for wasting resources for giving me multiples of the same test before I left. Made me feel a bit better. Sorry to hear that, as I have learned very well from the inside. Some healthcare workers are just judgmental sobs. Welcome to humanity. I get it. But since you're dealing with people's intimate problems and information, I feel the standard should be higher. Even if the job could make one cynical. The big one in the ED now is a lot of staff casually accusing people of being drug seekers at first sight. Now drug seeking is a major problem. But a lot of these people who are accused turn out to have a fracture or other legitimate condition. I would rather err on the side of giving an addict a dose of painkiller and not let someone truly in pain suffer. Man who rode his bike as sole method of transportation came in for chronic knee and leg pain. He had metastatic prostate cancer with bone lesions all over. Came in for my legs hurt. Left with hospice referral. Something similar happened with my father. His lung tumor pressed on a nerve, which manifested as shoulder pain he thought he got from playing so much tennis. Was first treated for pain only. Took some weeks until he received the diagnosis. Dead 12 weeks later. Pancoast tumor. Rare but taught frequently in medical school. I'm sorry for your loss. I was in my work placement years when this happened. A man in his early 20s has committed a crime and claimed that he won't be going to jail because he self-diagnosed himself with personality disorder from Google search. Police officers brought him in for my mentor to diagnose him. My mentor exact word, "You do not suffer from personality disorder. You're just an asshole." I'm waiting for the day I could use the same line as my now retired mentor. Edit. My mentor did not diagnose him, by the way. He knew the guy was faking it and all the police needed was a confirmation from a medical professional. Yeah, if antisocial personality disorder was a get out of jail free card, well, yeah. Jails wouldn't work so well. Diane Down has several diagnoses, and she is still locked up as a result of it, because she is considered high risk. Her diagnosis: a narcissistic personality disorder, histrionic personality disorder, and antisocial personality disorder. She didn't get these diagnoses until after she shot her kids. I read people don't usually get diagnosed with these until they commit a crime because of the stereotype that everyone with cluster B commits crimes. This thread is like reverse WebMD. Think it's cancer? You just stubbed your toe. Think you have a cold? 100% cancer. I'm kinda hungry. How long do I got, doc? Won't make it through the night. Not a doctor, but a doctor diagnosed my wife with her STD, chlamydia maybe. Huge fight. Wife was emotionally crushed. She accused me of cheating. Ducked up. I punched her symptoms into WebMD and told her it was probably kidney stones. Turned out to be kidney stones. Edit. Words. She accused me of cheating. Ducked up. I punched her. That escalated at a relatively predictable and reasonable speed. He gave it away earlier in his comment when he said they got into a huge fight instead of an argument. Ducking. Like and subscribe.